I am beyond thrilled to announce that doors will soon be opening to the Wholesome Fertility Method online program. If you've been listening to this podcast, you know that I love to infuse meaning and spirituality into my practice, and I'm so excited to be sharing this program that I have put my heart and soul into. I have left no stone unturned with the creation of this program. This course includes everything that I provide for my patients, including how to understand your charts from a Chinese medicine perspective, detox recipes and protocols, simple and easy ways to go clean on products and cosmetics, research-backed nutrition that has been shown to improve fertility health, fertility-boosting supplements and herbs, breathing exercises, bonus fertility yoga videos, techniques to awaken your innate power to heal yourself, and what answering your sacred call really means. My deepest intention with this program is to empower and inspire you to align with your highest self. I will be offering both independent study as well as added coaching, which has limited spots available. If you're interested in getting on the waitlist, then don't wait. Visit www.thewholesomefertilitymethod.com now, as doors will only be open for a limited time. You will not want to miss it.
Episode number 54 of the Wholesome Fertility Podcast.
Welcome to the Wholesome Fertility Podcast. I'm Michelle, a fertility acupuncturist, here to provide you with resources on how to create a wholesome approach to your fertility journey. My next guest happens to be one of my favorite fertility practitioners out there. She is an amazing voice of education for women and people going through fertility challenges. She has her own podcast, which actually inspired me to start my podcast. I learned so much just from listening to her. And I am talking about Lisa Hendrickson-Jack, who is the host of Fertility Friday. So Lisa was on my podcast before, and our interview got cut off. So I was really happy when she agreed to come back on the podcast. And somehow even this podcast had a couple of glitches, so I had to seamlessly edit it. So there are points where things kind of got lost in the middle of conversation. So if it doesn't seem 100% to flow, that's why. However, we did get most of it, so I wanted to just really keep the most of the conversation in there, which luckily the most important parts are in there, and we were able to have pretty much a complete podcast episode. So Lisa Hendrickson-Jack is a certified fertility awareness educator and holistic reproductive health practitioner who teaches women to chart their menstrual cycles for natural birth control, conception, and monitoring overall health. In her book, The Fifth Vital Sign, Lisa debunks the myth that regular ovulation is only important when you want to have children by recognizing the menstrual cycle as a vital sign. Drawing heavily from the current scientific literature, Lisa presents an evidence-based approach to fertility awareness and menstrual cycle optimization. She hosts the Fertility Friday podcast, a weekly radio show devoted to helping women connect to their fifth vital sign by uncovering the connection between menstrual cycle health, fertility, and overall health. So welcome to the podcast, Lisa.
Thank you. Thank you for having me.
Yes, I really wanted to have you back on because last time I had you on, I was so excited. And then of course, at the end, we were just talking about this in the pre-talk about how technology doesn't always want to help you out, so it wasn't really cooperating, and it cut our interview short. So luckily, you agreed to come back on, and really happy to finally have, fingers crossed, a full interview.
Yes. Were you using the same thing, the Zencastr?
Yes, and it normally works. It always works, actually. And it was just, I don't know why it didn't finalize the track. So,
okay. Yeah, you never know with technology. But let's just put some good juju out there.
Yes. Some fairy dust.
Yes.
Some fertility podcast fairy dust. We got
That's
two
right.
fertility podcasters. So can you share how your own menstrual difficulties growing up led you to doing the work that you're doing today?
Yeah, absolutely. In my case, from the time I had my very first period, which was around age 14, my periods were painful, like from the start. So even my first one wasn't like horrific, but even from the very first period, I always had pain with menstruation, and I always had heavy bleeding. So it was something, and I was very active as a child. I was in ballet and track and basketball and volleyball and, all the things. And so I was, very, very active. And so it was challenging. I mean, it's hard enough, when you're doing ballet, wearing those leotards and stuff, to be worried that because there's nowhere for it to go if it leaks. It's just a horrible day for everybody.
Yep.
So at that young age, I didn't know anything else, any other way to manage it. So I went to the doctor fully intent on getting the pill. And, in my case, like fortunately or unfortunately, I really only had to say like 3 words and the doctor was already writing the prescription. Like my periods are kind of heavy and painful, and he was already like writing the script. So that helped me to manage, as it does for many women, the symptoms. But because I wasn't actually taking it for birth control in high school, I would go off of it periodically just to see if it was still the same, because it's presented as something that's treating it.
Right.
And so every time I went off of it, my periods would come back with vengeance. Like sometimes it felt like worse than they were before, or just as heavy and painful. So it was very clear to me early on that although it was giving me relief, it wasn't fixing the problem, because the problem was still there. And and then I always say, like, when I talk about this, that my parents are kind of old school. So my dad every now and then would kind of just be like, "You still taking that thing? You still on that thing?" I think it was just partly embedded in me that like, okay, this isn't like I always did think there was a problem. I didn't think that it should be that painful, because I knew friends that didn't have that much pain. I also saw my mom go through really heavy periods. So she didn't have pain, but her periods it was flooding every time, and she had fibroids. And I saw, how that affected her. So, I'm an only child. They wanted to have more children. She had a miscarriage, and I was really young, but it was kind of that understanding that it was related to everything. And eventually she had to have a hysterectomy. And, my aunt came to stay with us. I talk about this briefly in the 5th vital sign. And she, I'm really young and probably like 10 or something, and having these conversations with them. And my aunt shares that she had fibroids too, and she also had a hysterectomy. And she was sharing about how, there was one time she was going to work, and she was wearing like one of those, I call them like torpedo tampons, but one of those like super tampons, and like the thickest pad you can have, and she was still leaking through, within a matter of an hour or so. So you can just imagine then, given that story and my own experience of having this pain, having the heavy periods, seeing that it's clearly an issue in my family, and knowing that the pill wasn't fixing it. So this kind of predisposed me to question all of it.
Yeah. Yes.
So when I discovered fertility awareness, first of all, it was like, wow, okay, I can avoid pregnancy. I don't need to be on the hormones, because I didn't want to be on the hormones. I felt like there's obviously something wrong here, and I feel like the hormones aren't making it better. So I don't want to do anything. I don't want to add anything else to the pot that could mess it up, because I knew I wanted kids at some point. And I was like, okay, I know I already have these challenges, so I just didn't want anything else to add to it. So yeah, that, to answer your question, all of that is what predisposed me to this work. And then to discover that, not only is charting really great for avoiding pregnancy or timing sex correctly when you're ready to get pregnant, but it also gives you a window into your health. And when you have issues with your cycles or your periods, it's an indication of a broader, deeper issue. I mean, all of that helped me personally in my own life to improve my cycles naturally. When I first started charting, they were an average of like 38, 40 days. And so, a brief picture into my journey, like I identified a thyroid issue through charting. And over the years, I was able to no longer have pain with periods, improve the length of my cycle without the hormones. So my cycles are now within the normal range and all of that. So all of those experiences just taught me that there's a lot more to the story. And also, as women, we're not even privy to any of that. Like there's so much more to the story, but we're never even told the story to begin with.
Right. 100%. And when you first started charting, it was a course that you took, correct? It was at college.
Well, so what my first exposure, I call it my like post high school feminist phase.
Mm-hmm.
On my university campus, we had a women's center, and they were always doing events and bringing speakers to campus and things like that. So there was a speaker, Inga Musio, author of the book Cunt. The
Mm-hmm.
book is actually called that, A Declaration of Independence. And so she came to read an excerpt from her book. And she doesn't go on about fertility awareness in her book, but she does mention it and mentions that you can avoid pregnancy naturally by identifying when you're fertile based on your cervical fluid and your cervical position changes. And so
Mm-hmm.
she's reading this excerpt. And that was the first time I'd ever heard that. And so because of the Women's Center, I was able to, find additional resources. So when I very first started charting, I ran out and bought a copy of Taking Charge of Your Fertility. And
Mm-hmm.
I, jumped right in and started doing that. But on my university campus, there was also a group of women who met every month, basically,
Mm-hmm.
some of whom were certified instructors and some of whom were training to be instructors. And so then, of course, I attended, and I just kept attending until I was actually part of the group, and I took a training class at that time, and I began teaching as well. So that was how I got into charting.
And when you did start charting and you started noticing irregularities, how long did it take you to like really almost I don't want to say self-diagnose, but like really understand that something was off with your thyroid? Like, was it after taking the class and like learning how to interpret it? Because it's one thing also to chart and it's another thing to learn to interpret it.
Well, that's a great question. So I did not self-diagnose. So keep in mind that I was young when I discovered charting. I was 18.
Yeah.
So I was charting and reading all this cool feminist literature and attending all these cool things, right? It was fully in the prime of university days. So when I started charting, and I also, taking charge of your fertility in tow. So when I started charting, I just made longer charts. And I remember thinking like, oh my goodness, 28 days is a myth. And I'm Lisa and I have 40-day cycles. And that's totally
Mm-hmm.
fine. So at first, I didn't think there was anything wrong at all. Like I just thought that that was just me and that it was okay. And
Right.
so the reason that I was able to figure this out was because one of my charting instructors looked at my charts in one of
Mm-hmm.
our sessions, our monthly sessions, and she was like, okay, Lisa, your
Mm-hmm.
your temperatures are way too low and your cycles are way too long. You need to go and get
Right.
yourself checked for thyroid. So I actually went and got thee to the doctor and did a
Mm-hmm.
test for my thyroid. And I mean, what's interesting about charting is that in my case, I didn't have all these overt thyroid symptoms because it hadn't got to that point yet. Like by the time you're overweight and depressed and all of like the kind of like the really kind of bad on the spectrum, like by the time you're going to your doctor with a full blown issue, I mean,
Mm-hmm.
in my case, it was still in those subclinical stages. So it was on the
Right.
chart and it was
Yes.
not completely out of control. So
I
in my
totally
case,
get what you're
yeah,
saying. Yeah, because you could that's what we do. Chinese medicine practitioners, we could detect blood deficiency before it becomes anemia, for example.
exactly.
You could see things and charting, I have everybody chart because it really gives me insight as to if they're properly ovulating and what's really happening with their body, if they're able to increase their temperature in the luteal phase and sustain it. I mean, all these things are so important. And then even if people miss, I'm like, just 1 month at least of like a full spectrum so we can see the charts is huge. It's huge. It doesn't matter how good of a pulse taker I am or how good I am at looking at tongues and just questioning, to not see the temperature is it's a big miss. It's like a really, really important aspect of everything.
Oh yeah. I mean, for me, that's the center of what I do. That's how I've been trained. And so anytime I'm working with a woman, of course, a big part of it is learning how to chart correctly and,
Hmm.
using it for whatever the purpose is. But you can, like, it's hard for me to imagine even working with a woman in any capacity without having that.
Yeah.
Not because the chart doesn't allow you to give a firm diagnosis. So the woman, my charting instructor wasn't looking at it and like, 'cause you can't, she's not a doctor. You can't diagnose, but there were the signs of it. And so in my case, it was like what she saw did coincide with what eventually did become my diagnosis. And I think
Right.
I always think of this, which you touched on as well. But in my case, because I was charting, like I said, I had no symptoms and I was
Yeah.
super young. So this would not have been detected. So I was able
Right.
to catch this early. And
Exactly.
even now, almost 20 years later, like I am not, like it was always managed and controlled. Like it's never, ever gotten out of control.
Hmm.
And I wonder though, if I hadn't been charting,
Right.
like eventually it would have caught up to me, but it would have been,
Yes.
you know what I mean? Like it's so interesting to think of what would have happened if I hadn't had that early kind of heads up.
Yeah, totally. And so like, yeah, it's not a diagnosis, obviously, but it's clues. It's huge clues
Well,
to
that's
point you in
exactly
that direction.
the concept of a vital sign, because high blood pressure in and of itself doesn't
Hmm.
diagnose an illness, right? So if you were
Correct.
to compare it to
Yeah,
other vital signs, but obviously it provides some very crucial information on the way to getting that diagnosis.
exactly. And it's silly not to utilize it because it's so easy. It's just a matter of getting used to.
Well, easy if you've been trained in interpreting charts. So the challenge is that not all healthcare practitioners, and in fact most, you
Right.
know, there are certain modalities, obviously, like Chinese medicine, where there are aspects of the chart that you can pick up on and general understanding of like, okay, if the cycles are too long or short or whatever the case. But
Yeah.
for example, when you are trained specifically to look at all the parameters, so for example, like if I'm looking at someone's chart, I'm looking at, of course, the overall length, you're looking at the period, the length,
Hmm.
and also the volume, you know, if the bleeding's happening during the period or like all the time or at times when it shouldn't be.
Hmm.
Also the quality of cervical fluid. So that's something quite particular that, you know, most practitioners are not trained in, to look at the cervical fluid in such detail that you could actually identify patterns and have that be more of a diagnostic kind of capacity. And then, of course, there's the luteal phase, understanding the basics of like, is it long enough and are there signs of low progesterone, you know, those types of things. So it's helpful for, you know, the listeners to understand that it's more than just your period, because often even if I'm asked, like, could you talk to us about the health, like what's a healthy cycle? Often women are meaning, can you tell us about the period? So it's
Hmm.
helpful to
Right.
know, okay, we're talking about the whole cycle. The period is the
Right.
first part of the cycle, but we're talking about
Exactly.
like what happens in between periods.
Right. It's true. It's a good point because people hear menstrual, they think of blood.
Of course, because I mean, blood is the most obvious thing.
Yeah.
It's, you know,
Yeah.
and as women, we're not really taught about cervical fluid. You know, I always think, oh, it'd be so nice. Of course, I would say this because I'm a, you know, fertility awareness educator, but it would be amazing if young ladies were taught about their cervical fluid in kind of an equal way as they were taught about their periods, so that they would understand, okay, you know what, ovulation is actually the main event here, and ovulation is how you make your hormones. Ovulation is a sign that you're healthy. And as you ovulate, as you approach ovulation, you produce cervical fluid, which is normal and healthy. So just
Right.
be, because
Exactly.
as you know,
Because
like,
yeah, it looks abnormal for me. It was when I was younger. I was like, "What's this?"
right, and you think you have an infection, and how many women
It's
have
true.
gone to the doctor because they have this abnormal discharge, quote unquote,
Right.
and
Exactly.
end up, even some of them, I'm sure, end up on antibiotics. And it's like, wait a minute, no,
I
this is
bet. I
normal.
bet. Yeah. I really agree with that. I'm
I've spoken to
sure.
so many women who they had no idea, so they just thought every month they were getting an infection.
Wow, it's just insane to think about. But it's just as insane as thinking that you can get pregnant every single day of your cycle.
But that's what we are all told. And for me, that was a huge part of why I gravitated so much to fertility awareness at my young age, because I was thoroughly terrified. Like when I decided to start, like when I was ready to start having sex. So to TMI, whatever day it is, but like I was 19, so I was already like a grown up. I had already been living out of my house for a couple of years. And so I was making this decision consciously, you know what I mean? Like I had been reading
Hmm.
books and I was always a nerd. So like all of this. So I was really taking that decision seriously of like, okay, how am I going to manage my fertility? And I was thoroughly terrified. I thought that I would get pregnant every day because that's what
Yeah.
I was taught. So learning that that was a complete lie
Yeah.
and it's
It
not
is.
even
It's the
true.
biggest lie.
That was really aggravating, obviously, but it was also very liberating. So for me, I was like, wow, okay. So, I mean, I can just figure out when I'm fertile. Because I think I was more afraid of like getting pregnant and not knowing. I was more afraid of being on the pill and like missing a pill and getting pregnant and then being surprised. And that to me felt more scary than to not be on the pill and to be, using condoms when I knew I was fertile and knowing exactly when my period was supposed to come. Like for me, that felt like manageable. Whereas the kind of question mark of like just trusting this thing felt too scary for me.
And also the imbalances that it causes, everything.
At the time when I was that young, I don't know that I really knew all of that. But with that being said, because I was learning charting so early, I very early on did discover the negative aspects of the pill. And I don't know what it is, like when I look at all the events that brought me to this place of what I'm doing in my life, it really doesn't feel random because I had a lot of girlfriends who had a lot of issues with the pill because I wasn't on it, right? Like I went off of it eventually, like when I feel like I'm the opposite of most women because when I started having sex, I just went off the pill and never looked back because I couldn't handle the thought of it for birth control, which is, I feel like I'm the opposite. So I had a lot of friends who were taking the pill. And I had a lot of interesting conversations over the years. So one of my really close friends, she went on the pill and she had to come off of it within like a month because she was like, it totally messed with her emotions. She was crying, she was laughing, she was pissed off, she was happy. Like it was just like a crazy roller coaster for her. And I think in her case, it was like her partner was like, okay, this is nuts. We need to and we were young.
Making you nuts. Yeah.
Yeah. So, and then I had other friends, we would talk about sex and it was like this wonderful female empowerment phase. And, we would talk about orgasms during sex. And some of my friends would be like, what do you mean? Like, I never orgasm during sex. And some of my friends would joke that like, well, geez, you go on the pill so you can have sex and you don't even want to have sex anymore. So it was very apparent in my own personal experience and the experience of just being in college and just in that with like having female friends and talking about, things like this, that I saw it. And I saw it, like I just saw women go through all the stuff. Like they would go on the pill, they would have emotional issues, their libido would go away, they would have trouble orgasming, and then they would come off the pill and it would be like a come to Jesus moment. And all of a sudden sex is amazing.
Yeah.
And so like, I don't know. I don't know what it is because I know a lot of women also have that experience because I've interviewed a lot of women who also saw their friends have issues on the pill. But in my case, I think because of the additional education and training that I had received around fertility awareness at that same time, it then led me to understand it in a different way.
No, I totally relate with what you're saying. First of all, I think we have very similar stories because I also had imbalances in my period and I wouldn't get my period for months at a time. I went to the doctor, was not sexually active, was given the pill and told that if I get off the pill, I'm going to go back to my irregular period. I'm like, wait a second, this doesn't make sense. But I remember thinking it doesn't make sense, but just kind of doing it because that was my only option, which I hear so many stories like this, like ours. And I also felt off. Like I knew that this was not a solution for me. And I knew that it wasn't really great for my body. Like I felt like I retained water. Just it didn't feel right, So I think intuitively, somehow, I think all women have that intuition. It's just a matter of like not knowing enough or not knowing to trust that early on until we get older and finally.
Well, I feel like I agree with you, and I feel like because when I was put on the pill, I was probably 15. So, I wasn't sexually active. I was 15. I wasn't fully an adult. I didn't know myself. Even in my 30s now, almost 40s, I feel like I'm still like, now that I'm older, like I feel quite like I know myself and all of that, but I still feel like I'm learning. I still feel like I'm uncovering layers, if that makes sense.
Yeah.
So
yeah,
at
totally.
15, there's no way. So when I look back, at the time I had no idea, nothing. And I wasn't told anything about any side effects. I did know that it was associated with an increased risk of stroke and deep vein thrombosis, because that was really the only thing that people talked about back then.
Right.
But that was like never going to happen to me because no one ever think like why, like no one ever thinks they're going to get a stroke.
You're like beyond that when you're young.
Exactly. But when I look back, so I'll never know. But there's a few things I know for sure. The only time I've ever had migraines in my entire life was when I was on it.
Mm-hmm.
And when I went to the doctor, they didn't say anything about the pill. They actually gave me like these like diet, like I just remember these tablets looking humongous and really scary. And I think I took one once for a migraine, and I swear it made me see things. So
Oh my
all
God.
I know, like I don't know, this is not
Yeah.
scientific. This is also, you know what I mean? But I just remember taking this drug, and it I feel like I had a hallucination, and I was like, holy cow. So to me, it felt like you're giving me really, really serious drugs here. But
Yeah.
no one ever said to me it could be related to the pill. This
Right.
is what I like. This was upon reflection many years later that I remembered that and made that connection. I was like, interesting, because I've never had a migraine outside of that. And
Right.
then, of course, as a teenager, my moods were all over the place, and I was super moody and all of that kind of stuff. Again, we'll never know. So I guess my point is that, like, when you, if, for example, if you are, you know, a young woman, you kind of, your cycle's mature, you're regularly cycling, and then you go on the pill in your 20s, then you have a frame of reference of how you would typically feel. When you're put on the pill right at puberty,
Right.
when you haven't even, like, you're still a kid, like you don't really have a good grip on who you are, what your sex drive is normally like, and all that, then it doesn't give you an opportunity to really make those connections. And so
No, and you're
when
younger too. You kind of you don't really you don't have that confidence to trust yourself yet, I feel like. And also you put a lot of trust in the doctors.
Well, exactly. So when you talk about the intuition, I mean, we all have that intuition, but I suppose, and again, whenever I talk about the pill, I always feel like it's necessary just to clarify, because there's a lot of women. I mean, I've used the pill, you've used the pill. You know, most women have used the pill. So this isn't to say that no one should ever use the pill. What I think is really important, though, is that, like any, first of all, we have to actually consider it a medication. A lot of women are on it, and we don't even think of it as a medication because it's just so ubiquitous, right? And so with any medication, we should be properly counseled on the side effects. What's interesting is when you look at the research, for example, you know, when teenage girls who are on the pill are much more likely to also be on antidepressants. So there's research studies that show this correlation. We know that the pill is associated with depression on multiple fronts. So the pill suppresses testosterone very significantly, and that's associated with an increased risk of depression. The pill also depletes several nutrients, including B vitamins, particularly vitamin B6, and that is associated with our production of tryptophan and serotonin, which are associated with mood. So there's very specific links to depression in the scientific literature, as well as women's lived experience, that a lot of women go on the pill and start to feel depressed and lose their libido. So what's interesting about that study that showed that women who are teenagers who are on the pill are more likely to be on antidepressants is that at what point would the medical professionals who are responsible for these women's care, at what point would they even say, okay, you know what? I see that you're experiencing depressive symptoms. Did you know that the pill is associated with an increased risk of depression?
Right.
Why don't we just have you come off of it or switch it up to a different one? At least that, right? But we could also have her come off of it for a couple of months just to see if it could be related to the symptoms. Like, this is a reasonable option. And why is it that that is not even being discussed?
That's a good question. It really is. But luckily, we're living in an age where we're able to actually get out there, and people are able to listen to podcasts and educate themselves. Seriously. You know, thank God for that.
Well, because where else would you, so I've interviewed a number of women, I've lost count, but I've, on my podcast, I do a pill reality series where I've interviewed a number of women who've had experiences on the pill, and they are just sharing it. So for me, I feel it's very important because it's not scientific. When you speak to Jane, and Jane was on the pill and she talks about her experience, that's not scientific, but we shouldn't ignore Jane. Jane is a real person, and that's her actual experience.
I'm with you 100%. Listen, I'm all about science. And it's great, but it's not the end all be all. Like we knew how to live off the earth without having microscopes. I mean, this is way before they were invented. You know, there's definitely a knowing that we can have from just observation, and it doesn't have to be a scientific lab with a peer-reviewed study, you know, in order for us to validate, yes, it's true.
Well, and it's really, like, I love science. I'm a nerd. I research, because I really like to make those connections. So I think in this day and age, it is important to have the science, because you have all these women.
It's important, but there's a balance.
It is.
You know?
But you
Yeah.
have all these women who've had these experiences. We have a history of medicine ignoring women's lived experiences. We have a history of women going to doctors and saying, I have these symptoms, and doctors saying, no, you don't.
Mhm.
You couldn't
Yeah.
possibly, it couldn't possibly be related. So one of the challenges, of course, is that a lot of women have these symptoms. So they do experience like depression or anxiety or low libido or whatever, and pain with sex, it goes on. And they go to their practitioners and they're often told, okay, there's no connection, or maybe they'll spend a couple of years trying out different types of pills, different types of hormones. And eventually they end up like one night super frustrated, desperately Googling. And that's when they discover all these other women who've had the similar symptoms, and then they make the connection. That's not fair.
Right. Yeah. No, I agree. But that's the thing. So there is this reliance. If it hasn't been studied, it doesn't exist. But if you're seeing that people are anecdotally feeling a certain experience and symptom, and it's a lot of them, does it have to be studied in order to say, yes, this is valid?
But then the irony is that it has been studied and there's so much research.
Oh, yeah. Well, that's a whole other thing. Yeah, that's a shame.
Yeah, I found no shortage of research to show the link of, between the pill and depression, the pill and painful sex, and the actual like reason why it does that. So our vulvar tissues are very sensitive to testosterone, and when you're on the pill, it suppresses testosterone in a couple of different ways. So, I think a lot of our understanding of how the pill works and the menstrual cycle and how we're able to kind of compartmentalize it. So we're kind of taught that our menstrual cycle only matters if we want to have babies, and it's totally okay to just shut it down until we're ready. We're also taught that the pill regulates, air quotes, the cycle, and that it makes your body think that you're pregnant. Neither of those things are true, just for the record. So when you're on the pill, it suppresses ovulation. That's one of the main ways that it works. It also thins your endometrial lining so that it's not thick enough to support pregnancy in case an egg ever did slip through. And then it also causes your cervix to fill with a thick mucus plug that you would produce naturally at certain times of your cycle, but it's just there all the time. So you're never making fertile quality mucus. So those are the reasons why it works, and it has to do that or else it wouldn't be effective. But if you think about it, it suppresses ovulation. So that suppresses your normal ovarian production of estrogen, progesterone, and testosterone. Also, when you're on the pill, it increases your production of a protein called sex hormone binding globulin, SHBG. And so what that means is if the analogy I use is if you imagine like those iron filings in a magnet. So SHBG just takes up your testosterone, like the iron, like the magnet would take up the filing. So what happens is that you just have significantly less free testosterone in your blood. And it turns out that even though as women we have about 90% less testosterone as men, we actually need it for our sexual function and even just for our sexual organs. So our vulvar tissues are very sensitive. And when we have this significant drop in testosterone, of course, it doesn't affect all women in the same way, right? All women on the pill would have this low testosterone, this low free testosterone. But some women, it's going to be, obviously, they're going to be more sensitive to it than others. So some women find that they have increased pain with intercourse. And when they do the research studies to actually analyze the tissues, they find that when women are on the pill, the vaginal opening, the actual volume of those tissues is thinner. So it thins the vulvar tissues. And there's studies that have shown that it shrinks the clitoris.
Wow.
Because the lack of testosterone has a profound effect on our actual tissues, which change. For some women, it makes sex painful, vulvodynia, like when you have pain with insertion, like pain with intercourse. And for some women, they find like lower libido. And for some women, they find that it's harder to reach orgasm or they have less sensation. But you wouldn't really know that if you were on the pill before you ever started having sex, like you wouldn't really know that. It's only really if you kind of were already an adult and already having sex and then you went on it and noticed a difference, then you would kind of know.
Right. True. That's a good point. So this is great information. I mean, just it's insane really to think about because nobody's being told that, especially to the detail that you're just saying it, it's just,
well, it's all there in the literature.
It is, but not a lot of people know to look for it.
Well, yeah, of course. And it's not necessarily like accessible and your doctors aren't necessarily telling you. And again, this isn't to say that no one should use the pill, but the thing is that like, okay, if you're going to go on medication, with the pill, if you don't even know that it could be associated with these issues, then you can have these issues and you're doing everything else. Like you're going to therapy because you're having issues with sex. You like, you and I can both appreciate that there are women in therapy right now because it's like, I don't have sex drive. I don't know. I wish I wanted to have sex with my partner. And then they're like going into their childhood trauma. And like, it could literally be that the pill suppressed their libido. Like, I'm not saying it's always that simple, but if you know all of the side effects associated with a drug that you're taking, then it gives you the opportunity to just make like every woman doesn't experience the same side effects, right?
Yeah.
But it's like, you should have a heads. It's almost like a girlfriend, like your girlfriend, you want her to be like, hey, Lisa,
you're experiencing something, you think you're crazy. You think it's like, oh, what's wrong with me?
Well, yeah. And so it's so nice if someone could just give you a heads up, and then it's like, okay, here's the list. And then like, imagine how it would be different for women if their doctor was like, okay, you're going on the pill, you know, it's safe. We've studied it all these years. There's a few side effects that you should know about. And okay, so if you experience like recurrent yeast infections, if you start to feel depressed or anxious or start having panic attacks, if you start to you know, have lower libido or painful sex and all those things, like if the doctor just like quickly like kind of like those commercials. I live in Canada, but
less people are going to want to take them. That's the problem. That's why.
Well, that's exactly why. Like when you look at so there's studies that are specifically designed for physicians. There's one study that I kind of called out in my book where the purpose of the study was to identify the characteristics of women who complained about birth control. Like, I'm thinking of all the things you could study. This is what you're going to study. But that's what it was. And so what's interesting, so they had women on the pill and they gave them surveys, and they, you know, so 50%, half of the women who were on the pill complained of various side effects, including all the ones we talked about, like, you know, low libido, depression, sexual side effects, etc. And so the conclusion that the researchers came to, and I kid you not, it's like written in the the conclusion, it was like, you know, it is difficult for physicians to prescribe the most effective methods without unduly discouraging women from taking it.
Wow.
And you're just like, this is why science isn't infallible, because you can have a certain result of a study, and the conclusion that can be drawn from that could be very different. So for instance, if I did that study, the conclusion that I would probably draw is, wow, 50%, half of women have issues with this pill. So maybe we need to look for other methods or other formulations that could, you know, allow women to have the effectiveness of these hormonal, if this is the goal, without all of these side effects. Like, that could be a conclusion you could draw.
Right, totally.
You could draw the conclusion that doctors must inform clients of these side effects so that they're aware of them, so that if they do experience them, they can, you know, come off of it, try a different method, etc. So I would come to a very different conclusion with the same data. Yeah.
Well, that's the thing. So, you know, it's a balance. You definitely studies are great. You know, you learn a lot from them, but you have to also use your own judgment when reading them and seeing them, because there's so many people behind the studies and you don't know what the agenda is, because it does exist out there.
Well, and if you're that's the challenge, right? Like, if you're into research and you're like, you know, practitioners who are listening and they're all over the research and things, at the end of the day, if all you're looking at is the abstract, that's, you know, you got to find a way to get the full text so you can actually read it and comprehend it. You can't just, it's just important to have your head on. And even when it comes to research, we have to ask certain questions. When I was researching for my book, there were certain things that I found difficulty finding at times. And so the question becomes, you know, if this is not being studied, why not?
Right.
And we have to keep in mind that especially if you're looking at studies for certain medications, you know, like the pill is something like a $30 billion a year industry. So
exactly.
If I am a company that's coming out with a new formulation of hormonal birth control, like, I have a financial incentive in this. And so if I do 20 studies and 7 of them show that it shrinks the clitoris, I could choose not to publish those, just so that you know. That's right. So we don't always know. Like, we talk about research studies as if they're totally like infallible and like as if it's some sort of religion. But at the end of the day, like, there are studies that are fully done and not published. Just keep that in mind.
Yes, that's a really good point to make. And that's true. That's exactly what it is. I think that once you start to look at studies, you start to realize that just as practitioners, you really start to understand that aspect of it. But if you're a layperson, you just hear, oh, there's a study. Oh, okay. So that means that this is true. This is what was studied. And that's the conclusion they made.
Yeah, you have to be able to critically think. I mean, that's part of the reason that, so with the fifth vital sign, I mean, not everyone has 2 years to like research thousands of studies and like put it together. But part of my passion at doing it and having conversations like this, like the one we're having right now, is because what astounded me was that the research is actually there. There's a ton of it. Yet the conversation hasn't changed. Yet the interactions in the doctor's office haven't changed. And so part of this, I mean, I think it's well known that it takes a long time for research to come into practice. And so the statistic is approximately like 20 years. So it takes approximately 20 years for the most current research to be implemented in everyday regular medical practice. I think it's really important to just to not take all of that to mean maybe, I mean, we have to put weight on the science, but at the same time, we can't do it to the detriment of our own selves, and we can't ignore what's happening in our own bodies. There's no test that's infallible, and there's not only one explanation for certain types of results. So yeah, it's important to be connected with your own body and not to dismiss the actual lived experiences of women. That's important.
Yeah, exactly. I think it just really comes down to, I always talk about the yin and the yang. It's all about balance. The body likes homeostasis. I think life likes homeostasis as well. We got to just kind of keep everything in check.
Mm-hmm. Absolutely.
So bringing up your book, The Fifth Vital Sign. So we're talking a lot about that. We talk about how important it is to actually pay attention, because really that's what it is. When you're charting, you're actually just paying attention to what your body's telling you. And it's also important to find somebody who can actually help and guide you to know what your chart, or to interpret your chart, basically. And so what are the different practitioners that can help?
Well, I suppose it depends on your situation and what you're going for. So, I mean, there's a difference between just generally having body literacy, which is a term that it typically just means that you have a general understanding of your cycles. You know how to identify your fertile window and when you're ovulating, and you know how that relates to your period, and so how to predict your period. So for some women, they're like, that is just what they're looking for. They just want to have a general understanding, but they're not necessarily going to use a method of fertility awareness for birth control. So if you're just looking for that general awareness,
or trying to get pregnant.
Exactly. But even, I mean, when you're trying to get pregnant, it's still important to have a good understanding of your cycle, because it's possible to, like when I first started this work, I kind of thought, how could you screw it up if you're trying to get pregnant? But that's kind of still based on the myth that, every day is fertile, and right. So when you're just understanding the basics, then in that case, you can just start paying attention. When you go to the bathroom, just take a look. There's certain times of your cycle, if you're just cycling naturally and you're not on hormones, there's certain times of your cycle that you're going to see some either creamy white hand lotion type cervical fluid, like when you go to the bathroom, or clear stretchy, or you might just feel really lubricative, really slippery at certain points of your cycle. So just that for some women is enough just to get them started and to have that understanding. When you're wanting to use fertility awareness as a method of birth control, it's not enough just to have a general understanding. So as a method of birth control, there's multiple different fertility awareness based methods, and they all have similarities. But, in addition to understanding your fertile window, you have to add a buffer period. So, we're always adding 3 days after you stop seeing cervical fluid. We're taking your temperature, and, after ovulation, the temperature rises, and your temperature has to be high for 3 days. And so there's certain rules that you have to follow so that it falls in line with the science, so that we're using the method effectively. It's helpful to know that, modern fertility awareness based methods are, scientifically tested, and up to 99.4% effective when used correctly. The key to answer your question of like what type of practitioner, if you're really serious about using the method for birth control, then I would suggest, working with a certified instructor. So someone who has taken training in a specific method of charting, who can guide you, because these days, as more and more women discover fertility awareness, everyone's calling themselves an educator. So it's really important to learn a specific method if you're wanting the full efficacy. So then on the flip side, if you do start to chart and you start to see that you have certain issues with your cycle, so your cycle's falling outside of normal parameters, your ovulation is delayed, or you have signs of low hormones or whatever the case is, but if you have cause for concern and your cycles are regularly falling out of the normal range, at that point, then you want to consider working with someone who is able to, understand that connection between your cycles and your health, someone who's trained in reading and understanding charts. And you would also want to consider working with a functional practitioner who specializes in hormones and fertility, especially if you're trying to conceive and you're wanting to figure that out. But again, the myth is that we only need healthy cycles when we're trying to have babies. Some of us just want to be healthy because we want to actually be healthy. So, I think it's really tempting to think, okay, this is just my cycle, I can sort this out on my own. And there's a lot that you can do on your own. But if you're finding that your cycles are not improving and you're consistently seeing that same issue, then you do want to consider working with somebody who has that functional background so that they can understand the connection between your health and your cycles.
Right. Also, I wanted to ask you, one of the things that I actually noticed in your book, which I liked, is the fact that you touch upon not just the cycles, but you also talk about diet. And you mentioned the bone marrow soup and just really, really getting the nutrients and how important that is if you're trying to get fertile and trying to get cervical mucus and trying to get everything in balance. A part of it, was it part education, part something that you've just learned growing up?
It comes from, so part of it is my specialized training in fertility awareness. So I'm a certified instructor and a Justice holistic reproductive health practitioner. Part of that also comes from, years of doing podcasts and interviewing experts. And all of the information that I share in the chapter around diet and also the lifestyle pieces is backed by scientific research. So essentially the way that I structured that chapter, so the chapter would be nutrition for healthy cycles, isn't to say, okay, you need to follow a specific diet, because you'll notice that that's absent. There's no like this diet or that diet. It's more just sharing information about the specific nutrients that we know are important for supporting hormonal health, fertility, egg quality, all of the things that within the research it shows are really crucial for optimal hormone health. And also from experience working with women over 20 years, when you start to support hormonal health, when you start to replenish nutrient deficiencies, and when you're able to do it at least in part with food, so you can't always do everything with food, but when you're able to figure out, okay, these are the nutrients that you need for optimal hormonal health, and these are the nutrients you need, for whatever you're trying to achieve. And then you ask the question of, well, where are these nutrients in the food? Like, which foods contain the highest amounts of these nutrients? And when you incorporate that strategy in addition to anything else that you're doing, often many women experience better results because, food has the nutrients that we need in the easiest way for our body to incorporate and absorb and understand.
Right.
So it's a combination of places where that comes from. But even, with our conversation today, it is really important to have those lived experiences, to see those shifts and to connect that with the science so that we understand why certain foods support fertility in the way that they do.
Yeah, I agree. It's important definitely also to just to know what's out there and to know that what's been studied. Also, another thing is what's good for you specifically, because even if it was studied, some people have sensitivities to certain foods and that kind of thing. We always were trained in, when I studied Ayurveda, is one man's food is another man's poison. It really also depends on your body as well. So it's kind of like a nice balance, which is why like the keto diet could be amazing for a certain percentage of people. And then for other people, it could be not so good.
Mm-hmm. I mean, there's certain fundamentals that, so for example, when you're looking at the menstrual cycle specifically, because I mean, for me, if I'm working with someone like in our sessions, the chart is up. We're always looking at the cycle. The menstrual cycle is a reflection of what's happening in your body hormonally. So in order to have a healthy cycle, you need to be producing sufficient estrogen as you approach ovulation. You need to be producing sufficient progesterone after ovulation in your luteal phase. So if you're working with a woman and like you can see in her chart that her hormone levels are suboptimal, then we have to kind of remember that what are hormones made from? Right? So your hormones are made from cholesterol. So there's certain things where, of course, everyone has their own sensitivities and everything like that. So we have to look at that and figure out ways to do that. And every individual person has to kind of figure out how they feel best and what is best for them. But there's certain kind of fundamentals that we also need to look at. So
yeah,
if you have really low hormones and your diet doesn't consist of any of the building blocks that you need to actually make hormones. And a lot of we live in a fat phobic culture, for example, and
it's true.
A lot of women are really afraid to even put a little bit of coconut oil or butter on their food because they are afraid that it's going to cause them to get fat. So a lot of women are eating low fat diets and making sure that they're reducing their fat as much as possible. And that's fine if your cycles are totally healthy. That's where the bio-individuality comes in. So if your cycles are totally fine, and when I say totally fine, I mean that for me, like I mentioned at the beginning of our call, I'm not just looking at the length. We're looking at all the different factors. Is your luteal phase long enough? Are you producing enough cervical fluid? Are you, what are your periods like, et cetera, et cetera. If your cycles are completely within the normal range and you have no complaints and no issues, you haven't been trying to conceive for, 2 years and it hasn't been happening. Like if everything is totally fine, then that's fine. But then if you find that you are having issues with your cycle, it is falling outside of normal parameters. You have been having challenges trying to conceive, and there are markers of certain challenges on your chart. So in a situation like that, then we have to actually look at, the diet and look at those fundamentals that are, the building blocks for healthy hormones, the nutrients that we know are associated with hormonal health, healthy ovulation, healthy eggs, all of those types of things. We have to actually look at those just with a question mark of, could this be related?
Right. Good point. And I also, one of the things also in listening to your podcast that I found interesting, it was when you were talking about things like Clomid and cervical mucus, because obviously cervical mucus is so important to keep the sperm alive and to help conception. Yet Clomid's also being used to help improve conception. But yet this is a little bit of a side effect that I think a lot of people aren't aware of.
Well, I mean, Clomid's, it's interesting because it's an anti-cancer drug. So the effect that it has on the body, Clomid makes your cells resistant to estrogen. So then your body can't accurately perceive how much estrogen is in your bloodstream. So what happens is, you take Clomid, it makes your body basically kind of unable to perceive the estrogen. And so then you end up producing more and more. And so for some women, that is why they're ovulating. What's interesting about that, though, is that there are a couple of side effects associated with Clomid. So one is that women who use Clomid, and in particular multiple rounds, find that they produce less cervical fluid. So I have seen it firsthand. I've worked with clients after several rounds of Clomid and failed IVF, and their cervical mucus production is very low. And another side effect that's known with Clomid is also that it can thin the endometrial lining. So in order to conceive, there's a minimum thickness of your endometrial tissue, so your uterine lining. So kind of like throughout after you have your period, you kind of shed the lining, and then in the first half of your cycle, you would build up the lining, and then the second half, the lining fully matures. So by the end of your natural cycle, when you're ovulating, you have a healthy lining that is thick and juicy, and thick enough to support the development of a fertilized egg. So women who use Clomid are known and have been shown to have thinner endometrial lining. So it's ironic that you're using a quote unquote fertility drug
right
to trigger ovulation when there are side effects that are, detriment
right, that can't sustain the pregnancy.
Yeah. So the like in terms of Clomid, the interesting thing about so with Clomid as well, what the research shows is that about 25% of women who use it don't ovulate. And Clomid is also like, not every woman who conceives, but in particular, like not every woman who conceives on Clomid goes on to have a live birth. So there is also a miscarriage rate.
That's a good point. That's a really good point. Yeah.
So just for the listeners who are like, well, now what? So there are other drugs out there. So if you are having a conversation with your doctor about IUI and you're looking, the doctor's recommending fertility drugs to make you ovulate, it's good to know that, Clomid isn't the only drug. I'm not promoting any drug, but I'm just sharing information. So another drug that is also used to trigger ovulation is letrozole or Femera.
Right.
Could be there's the name of the drug, and then there's the name of the product. But so for example, when they compare Clomid to letrozole tends to have, so letrozole, Femera, same thing, tends to have a higher rate of success, a lower miscarriage rate, and it still may have some of the side effects, but to a lesser extent. So it's helpful just to know that there are other options. If you're having that conversation with your practitioner, then it's helpful to kind of know that. And this is something that I talk about in chapter 17 of the Fifth Vital Sign. And I show the different studies and the results and the difference between the conception rates and the live birth rates and all that. Because again, it's all about having that information. But one thing I'll say that I find really interesting, and you may have found this as well in your practice, is that sometimes you have a client who is actually ovulating. And the doctors are recommending the fertility drugs to make them ovulate. And often it's because then you can time an IUI, like an intrauterine insemination. So you can time it so that it can be on the doctor's schedule, because you can't predict ovulation ahead of time. And so if you're trying to do a procedure, then a woman would really have to know her cycle and be charting and understand how it all works to attempt to correctly identify on how her ovulation happens naturally. So I find it to be very interesting as a femme educator that a lot of women are given these drugs, even though they are ovulating. And again, these drugs do potentially have side effects. So, are we being told all the information because it's going to reduce the cervical, the Clomid is known to reduce the quantity and quality of cervical mucus and to thin the endometrial lining. With IUI, when they do those procedures, the success rate, so the pregnancy rates per cycle, are quite low, 8 to 10%. So they typically have to do multiple rounds to get a decent percentage of success. So again, these are things, as women, we just need to have those conversations with the doctors and really understand, okay, what is the pregnancy rate? What is the live birth rate? Is that affected by my age? Because a woman in her 40s has a different success rate than a woman in her 20s. It's just how it is. And then how many rounds typically are necessary? What are the next steps if I do multiple rounds and it doesn't work? So all of these are questions that need to, like anything else, we need to have adult conversations about these things, so that when you're going into, a lot of women go into IUI, they spend the $2,000 or whatever, and then they obviously you think it's going to work, but did you know that 9 out of 10 women who go through one round of Clomid, it doesn't work? The percentage that it works is around 10%. So we need to kind of be aware of these things per cycle, not absolutely. That's why they do rounds of 3, because when you do 3 rounds, that percentage goes up to maybe 20 or 30%. But you see what I'm saying? We need to know this information.
Absolutely. It's a huge information. I was wondering, actually, an episode from you on this, but I think it would be great, unless I missed it, of the top questions that you should ask when you're going to a doctor. I'm sure you mentioned it, but I think it would be a great thing.
Yeah. Well, it depends on why you're going to the doctor. But
a reproductive endocrinologist, if you're looking to start Clomid or you need assisted reproductive therapy.
Yeah. The top questions that come to mind for me, again, it's all about that informed consent. I always go back there. And so you have to know the actual effectiveness of the procedure. And it's not to discourage you from having it or not, because if you're going to do it, you're going to do it regardless. We all know this. Yeah. I'm pretty strong-willed. If I'm going to do something, I'm going to do it. But I still have the right to know what to expect. Yeah. Although it can be very hard to hear. So there's an idea that we have in our culture that IVF is always there as an option, and it can, like, regardless of age. And again, not to discourage, but there are a lot of, there's money in IVF. So there's a lot of research around it. I always joke that, like, if you want to find the research, go where the money is, and then you'll see it. So there's a ton of research on IVF. There's a ton of research on IVF success rates and how it changes based on age. So the questions that you would be asking if you're considering, for example, IUI. So if you're considering an intrauterine insemination procedure, that's usually kind of like the first step if you've been trying for a while. Ultimately, I have a lot of other, suggestions and advice outside of that, because like I mentioned, a lot of doctors even like IUI is not as effective as IVF, right? Like, it's not on the same league of the chance of like a pregnancy. But it's important to ask, when I have this procedure, for this one procedure, what is the success rate? Like, what is the percentage of the time that it results in a pregnancy? What is the rate of miscarriage? And what is the percentage of the time that a live birth results? So there's a difference.
And that's really the most, one of the most important at the heart of it is the live birth results.
Yeah. Really. The pregnancy rates are all going to sound better than the live birth rates, but we need to understand that not all pregnancies result in a baby.
Yes.
So that's really important. The other thing to ask would be, what is the chance for my age range? Because if you're getting like an overall percentage, when you look at the literature, the percentage of success is very different if a woman is from 20 to 25, 25 to 30, 30 to 35, 35 to 40, 40 to 40, like, it's very, very different. And what I found in the research, and all women should know this because it's really important. So miscarriage is really common, and I think until you have one, you don't realize. So for me personally, I had a miscarriage very early on before I had my first son, and I had no idea. Like, as soon as I had my miscarriage and I started talking to my friends about it, like, everyone came out of the woodwork. I had a miscarriage too. I had two, blah, blah, blah. And I had no idea. But when you have a miscarriage, of course, my body is broken. There's something wrong with me. Oh my gosh. So we all just naturally go to this really dark place because it's a horrible thing. So what I found in the research is that the rate of miscarriage is highly correlated with our age. So in your 20s, the rate of miscarriage is still present, maybe 10 to 15%, of the time you have a miscarriage. When you're in your 30s, it may be more like 20, 25% of the time. By the time you hit your early 40s, it's about half of all pregnancies end in miscarriage. And by the time you're like 45, it's 3 out of 4, statistically speaking.
It drops. Yeah. Like, the percentage of being able to keep live. Yeah.
And it doesn't mean you won't be able to have a baby, but what this actually looks like as we get older, like in real talk, is that often we go through multiple pregnancies before one sticks. And if it's a horrible thing to talk about, and it's a horrible thing to say, but at the end of the day, I've had this conversation with a number of my clients, and when they hear that and they start to recognize, like, wow, this is the reality, this is what it actually looks like, then they start to kind of break from that, like, that shame and blame. And because, we're all so, like, just ready and willing to blame ourselves and think that it's something we did and all of that. But when you recognize that it's just, statistically speaking, it's just much more common to miscarry. And, by the time we're in our 40s, 2 out of every 4 pregnancies are, like, statistically ending in miscarriage, then it helps us to understand that and just look at it with a different, like, so if you have a miscarriage, you recognize, okay, this isn't necessarily the end of the world. It's still horrible, but I feel like as women, we're not told that. So then you're miscarrying and thinking there's something wrong with you, and not realizing that just as we get older, there's lots of reasons for that as well, but we just don't really, no one's telling us this.
Yeah, absolutely. So I think it's amazing that you're educating people, and I love your book. I really enjoyed it. It's great for me too. Just as a practitioner, I've learned so much because it's not my specialty to do charting. I do incorporate it, but it's not my specialty. So I think it's really important for all of us, the practitioners, for people, for women trying to get pregnant, for women trying to just see what's going on in their body. It's just so valuable. And I myself really admire your work just as a professional. I think you're super smart and you bring so much value to really the fertility world. So for me, it's an honor to have you on the podcast. And I thank you so much for coming on.
Well, thank you so much. That's really amazing of you to say. I really appreciate it. And I really enjoyed our conversation today.
And I also want to just let the listeners know, how can people find you and how can they find your book?
Well, thank you for that. The book, The Fifth Vital Sign, is available on Amazon in, paperback, ebook, and audiobook formats. And you can actually listen to, but you can read the first chapter for free at thefifthvitalsignbook.com. As for me, I've been podcasting for 5 years, so there's over 275 episodes. If you just search Fertility Friday in your favorite podcast player. And another great place to connect with me is Instagram at Fertility Friday. I post a lot of interesting inflammatory posts over there.
And I will say that she is one of my inspirations for starting my own podcast. I've been listening to her for like over a year, and it's been just amazing information. It's actually, to be honest with you, it's my favorite podcast on fertility is yours.
Oh, thank you so much. That's amazing. That's an amazing compliment.
It is. It's true. So thank you so much for coming on. It was just an absolute pleasure having you back.
Well, thank you so much for having me.
So that concludes today's episode. You can find all the links mentioned on the episode notes. If you're enjoying these episodes, please take a moment to leave a review. Reviews are everything to podcasters. You can find me on my website at www.thewholesomelotus.com. And please be on the lookout for my online course and program. This course has emerged from everything that I've been using for the fertility program I now offer at my office. I wanted to consolidate all of my suggestions and coaching and put it into a form that anyone can purchase and use. It was important for me to encompass key fertility health factors as well as guide you in implementing changes in your routine that are shown to boost fertility while being realistic and user-friendly. I will be offering this course with and without coaching. If you're interested and want updates as well as a free ebook on my top 10 fertility boosting habits, you can visit my fertility page on www.thewholesomelotus.com, where you can find the subscription form. I thank you so much for listening in and hope you have a beautiful day.